Jimmy was a really good kid. Never had problems with him. When he first came home and told me that he was taking the test and joining, I cried. I didn't want him to go because I knew where he'd be going, that he'd have to go to Iraq, and that just really scared me because he was my only son, and I was just afraid that he wouldn't come back.
I first met my husband, Jim. I was actually pen pals with him while he was in Iraq. And we'd write letters back and forth, and he'd call if he needed someone to talk to. We ended up getting married. We were only together 6 months.
I love my country, I really do. I just love the fact that it's a free nation, and that's what I wanted to defend. Just see the world, see different things. In the area that I was in, we had one of Saddam's weapon facilities. It was bombed out. There was still a little bit of weapons in there, and we had to keep going in there to get whatever was left and destroy it or give it to the Iraqi army. It was a black area, which meant you shoot to kill. So we would always be on constant guard when we go there because you always had at least 15, 20 people in these warehouses, in just abandoned shops, and get into gunfights. There was an incident where we got trapped inside one of them. Lo and behold, they decided to give up because we weren't backing down. We've gotten into gunfights where we were in villages and there's innocent civilians and you get contact from one of the buildings, but we have to return fire because we know that it's the terrorists. And next thing you know, you're going to do a CAS report and you're seeing these little kids dead, these women dead, all these men dead. Those are the hardest things that any soldier deals with, other than the loss of a comrade. It's just something that messes with you. You just don't know how to deal with it, how to process it while you're over there. And especially when you come back, because that mentally breaks you down. It's hard to talk about. Once I got back from my first tour, I just feel angry about everything and just feel like nothing else mattered. I was trying to drink my sorrows away from everything I experienced.
One night, I was getting up to go to the bathroom. He pinned me to the bed and told me it's not safe. You know, he's home and he's safe, and he still doesn't feel safe. He thinks he's still in Iraq when he's sleeping. Nights I would wake up and see him get out of bed, and I would follow him. He'd never make it back to the bedroom. One night, I turned around the corner and surprised him and ended up with me up against the wall, and he had his fist up as he was gonna hit me, but he hit the wall next to my head. I was scared, I was pregnant, and all I thought about was my unborn child. But I also didn't want to leave him at the same time.
We had no idea what was going on. My son was never like that. And he came home a totally different person. And it's sad. Well, because they need the help and they can't get it.
PTSD is a very devastating condition and illness for someone to have to live with. You can easily understand, I think, some of the secondary symptoms or problems that veterans with PTSD develop. You know, marital problems, divorce, separation, substance abuse, using or abusing drugs and alcohol. Female service members report that they have experienced assaults as well as other forms of harassment. It's been very traumatic for them. Suicide is just running rampant. I'm sorry to say the latest statistics show that one veteran almost every hour of the day kills him or herself. Many veterans, for a variety of reasons, and I don't think it has to do with the quality of the care in the VA system itself, they would prefer to get help in their own communities from other types of providers. And just as their whole experience made a significant difference in their lives, it made a significant difference in the lives of their families as well. So just as the veterans need assistance and help, so do the families. Veterans are everywhere. Even here at St. Francis Hospital, there are many veterans.
I'm fortunate not to have experienced flashbacks. And one of the reasons was I wrote a book on Vietnam. That was my debriefing. That was my recovery time. The mental scars, they don't go away. It's difficult living on. Many from Vietnam have, and many from Iraq and Afghanistan are learning how to. If we can get these people back, they can pursue higher education and better jobs. And that, one by one, will strengthen those families and our communities.
What treatment's meant to my family is a better life. It's made me a better person. St. Francis, I love the fact that you're trying to help the vets, trying to get this behavioral health clinic put in from one soldier to many other soldiers. We would love it.
I think what St. Francis is doing is amazing. The families and the soldiers will benefit from what they're trying to accomplish.
It's a long road. I'm slowly getting my son back. The vets need so much help. They fought for us, then we can fight for them.
It's clear that we need community-based, outpatient, mental health and chemical dependency services for our veterans. I think St. Francis Hospital is uniquely positioned. Our behavioral health program goes back more than 50 years. I think it's connected to St. Francis himself, the person who before he was a saint, he was a soldier, actually, so we can even think of him as a veteran, our patron saint. It's been our tradition to listen to the call coming from our community and to respond with programs, services of the highest quality with trained professionals who know what they're doing and can produce very positive outcomes.